So celiac disease is an autoimmune disease in the digestive system in which the immune system mounts an attack on the small intestine, damaging the villi that lines the tract. This response is due to gluten, which is found in your grains wheat, rye, barley, and triticale. It's a wheat-rye cross. And what happens is once the body senses gluten in the system, your immune response attacks the small intestine. So the big deal about this is once the mechanical digestion has already been completed in the oral cavity and the stomach by the time the chyme reaches the small intestine. In the small intestine, chemical breakdown of your proteins, your carbohydrates, and your fats is finished, and the next step in the process of digestion is absorption. So that is what the small intestine is structured to do. It's got these deep, permanent folds of the mucosa and the submucosal layers called the circular folds, and these folds are lined with villi, which are finger-like projections which contain microvilli composed of columnar epithelial cells called enterocytes. And once all of the chemical digestion has taken place, the villi and the microvilli, they absorb the nutrients back into the bloodstream. So when a celiac patient eats gluten, what happens is the immune response is mounted against the villi and absorption can't take place. So what's left of the excess nutrients and the fluids from the digesting food, they get sent through the large intestine, which doesn't have any absorptive capabilities. All of the absorption happens in the small intestine. So the result is abdominal pain, upset stomach, diarrhea, and cramping. And then in the long run, if a patient with celiac disease continues to eat gluten or fails to get treatment, malnutrition continues, and there can be other medical issues that develop to include infertility, seizures, osteoporosis, and anemia. Okay, so to drive home this point, I have just a brief experiment to show what a normal small intestine does versus what a small intestine does that has been damaged by celiac disease. So we'll start with the normal small intestine first, and this is your stomach with all of the chyme and beginnings of the chemical digestion. So this is your small intestine, and as it gets forced through peristalsis through the walls of the small intestine, you see some of the liquid and the secretions, and this is the absorption that goes back into the body into the bloodstream. So as it works its way down, more and more of the key nutrients gets absorbed along with the excess fluids, so that when it comes out, what you're left with is the unusable elements of digestion that this is supposed to signify the small intestine of a celiac disease patient. As you can see, all of the villi are damaged, and it is a impermeable tube ultimately. So I've decided that I'm going to eat applesauce, and it's going to go through my stomach and through peristalsis, work its way through the small intestine, all of the churning, and as you can see, there's no absorption happening, and nothing's returning back to my bloodstream. And so it gets forced through all the way to the large intestine, and it's very runny and watery, and causing the upset stomach and the bloating and the diarrhea and whatnot. Basically, in short, gluten causes the body to attack the villi of the small intestine, making it impossible to absorb the key nutrients. And this will lead to malnutrition of the body, and over time can result in anemia, osteoporosis, infertility, seizures, and other medical problems.